Do you have trouble swallowing when you eat, or need to take a drink after every bite? Do you eat slowly and finish last? Does your child refuse to eat or experience vomiting and abdominal pain? These are some of the common ways the symptoms of eosinophilic esophagitis, or EOE, can appear. Some symptoms may lead you or a healthcare provider to think you just have frequent heartburn or even gastroesophageal reflux, or GERD. But EOE is a chronic allergic disease that affects the esophagus, which is the tube that connects your mouth to your stomach. It occurs when eosinophils, a type of cell in your immune system, build up in the esophagus due to an allergic reaction and cause inflammation. At first, this just causes irritation, but over time, it can lead to scarring and narrowing of the esophagus. Because EOE can occur at any age and often gets worse over time, it's important to get a diagnosis as soon as possible. And more than just the symptoms, patients with EOE often experience depression and anxiety and may face challenges with normal daily activities. Unfortunately, it sometimes takes several years for EOE to be diagnosed, but there are some factors that you and your healthcare provider can think about to see if you're at risk for the disease. For example, men are much more likely to have EOE than women. The disease is more common in white people than in other races or ethnicities, and it runs in families. It also often occurs in people with other allergic diseases, such as eczema, hay fever, and asthma. So if you or your child have symptoms of EOE and have some of the risk factors, it may be time to talk to your primary care provider or a specialist to find out for sure. If you or your child are diagnosed with EOE, know that you are not alone. It may be frightening to be diagnosed with a chronic disease, but there is good news. First, EOE does not lead to other gastrointestinal conditions or cancer. Second, working with your EOE healthcare team, you can make a plan that's right for you or your child to help put you in control of the illness, symptoms, and your life. There are 3 main choices for managing EOE, including diet, medication, and a procedure called esophageal dilation. But it's important to know that treating EOE does not have a one-size-fits-all strategy. For example, dietary changes that might seem simple for one person may be impossible for someone else, such as a college student always eating at the school cafeteria. Dietary strategies usually involve removing one or more types of foods from your diet, such as dairy, wheat, or nuts. These strategies are safe and can be very helpful for a large number of patients, but they may be hard to stay on for a long period of time. There are a few types of medications that are often used for treating EOE and are generally safe, including proton pump inhibitors, swallowed topical corticosteroids, and an injectable biologic therapy. Of course, they don't work for everyone, and all have some side effects that you and your healthcare provider need to pay attention to. Until recently, there were no medications that were approved by the Food and Drug Administration for EOE, but there are now 2 approved treatment options: a swallowed topical corticosteroid for patients 11 years of age and older, and an injectable biologic medication for patients 1 year of age and older. As with diet, it's important to make a decision with your provider about which medication may be best for you, according to access, ease of use, how the medication is taken, safety, effectiveness, and lifestyle. Medications differ, and even if they might work, you have a voice in your or your child's treatment. What's important to you? Is it how the medication is taken? Is it how often it's taken? Is it the evidence for how well it works? Is it the possible side effects? Your preferences are important, and you need to share your priorities with your healthcare provider. Finally, there is a procedure called esophageal dilation, which uses a balloon or other device to stretch the wall of the esophagus. This procedure is used to improve symptoms when there is a narrowing of the esophagus, but it doesn't address the inflammation in EOE. With all of these treatment options, you and your healthcare provider can find a plan that works best for you or your child. Don't wait for your provider to ask about symptoms. Bring up the topic with them. You may feel uncomfortable starting the conversation, so prepare for your appointment. Take advantage of the additional resources provided to educate yourself on EOE and questions you should ask. Stop trying to simply cope with symptoms. Talk to your healthcare provider to have your voice heard and start living your best life.